Hello, and thanks for joining us. Welcome to the 2022 American Diabetes Association Living with Diabetes Ask the Expert series. Today's topic, partnering with clinicians, conversations to have with your healthcare providers. My name is Carla Cox, registered dietitian nutritionist and certified diabetes care and education specialist, and your host for today's program. Our Ask the Expert series is all about answering questions from our listeners, so start getting your questions ready. For those of you on the phone, *3, that's *3 on your keypad, and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your question live. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button and your question will come directly to us. Stay with us through the hour and you will learn useful tips to help you live well on your journey with diabetes. In addition, we invite you to provide us with your feedback in a survey when you leave the event. We will use the information to help us plan for future events. You will be able to participate in the survey by using the link. There are two options. https://tinyurl.com/ATE004 via your computer. So that is https://tinyurl.com/ATE004. Or you can text the code at ATE0614 to the number 833-373-0403 to complete the survey on your mobile phone. You will also see that on a ticker tape throughout this session. If you are joining us on Facebook, YouTube, or listening to our podcast, please be sure to give us your feedback by completing the survey. Okay, now a little bit about why we're here today. Because of the link between diabetes and heart health, the American Diabetes Association, in collaboration with the American Heart Association, has launched No Diabetes by Heart. With support from founding sponsors Novo Nordisk, as well as national sponsor Bayer, the No Diabetes by Heart initiative provides tools and resources for people living with type 2 diabetes to learn how to reduce their risk of cardiovascular disease. As part of the initiative, the ADA is holding this free educational Q&A once a month. We'll cover information and tips to help you take charge of your health. When you have diabetes, it increases your risk of heart disease and stroke. Make sure when you see your doctor, you talk about your risk and works towards prevention. I'm happy to introduce Joanna Gibbs, PA, as our expert today. Joanna is a physician assistant at the University of Colorado Anschutz Medical Campus, specializing in endocrinology, diabetes, and metabolism. She is also an instructor in medicine, metabolism, and diabetes at the University of Colorado. And I've known Joanna for several years as we both work together on Camp Colorado, helping children with diabetes at camp. So, Joanna, do you want to add a few lines here to introduce yourself?
Well, I appreciate that, Carla. I think that pretty much sums it up. I'm very excited to be here today, and I'm looking forward to hearing what people have questions about.
Great, thank you. As we are waiting for our callers and online listeners to chime in, I'm going to go ahead and kick off with the first question. Could you please spend a few minutes setting the stage for today? What would be one great way, and there are lots of them, but one great way for a person with diabetes to get ready for their appointment with you or their provider?
That's a great question. I think if someone's coming to see me for the first time, getting ready includes making sure that they are able to give me their history and really kind of give me an idea about what their goals are for the visit or why they're coming to see me. If it's somebody who's seen me before, just being prepared with, again, kind of what their hopes are for the visit, what's happened since the last time I saw them, and I think that's pretty much it. Just being prepared, having great questions ready, and knowing what they'd like to get out of the time we have together.
Great, thank you. If you're just joining us, welcome to today's Ask the Experts Q&A, partnering with clinicians, conversations to have with your healthcare provider. As a reminder for you on the phone, press *3, that's *3 on your keypad, and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your question live. Please give your name and location. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button and your question will come directly to us. Remember, today's topic is partnering with your clinician, so let's remember to focus on that topic for today's event. Okay, so let's start by taking the first question. We're going to go to Jennifer, and Jennifer's from Pennsylvania. Jennifer, you're on the phone.
Hi, how you doing?
Good.
Hi,
Can
Jennifer.
you? Hi, how you doing? Yeah, you want me to repeat the question or?
Yes.
Okay, it's kind of long, but I was diagnosed with prediabetes in February. Okay,
Okay.
and my A1c was 5.7. Okay, so I got into a prediabetes program online that I'm in, and I've been doing the diabetes diet. I lost 16 pounds, and I had my A1c checked a few weeks ago, and it came back 5.4. Okay. So I thought I had reversed the prediabetes because I got the number down. Okay. So when I got my blood sugar checked, I got blood work done last week, and they checked my blood sugar. They did a fasting blood glucose test.
Okay.
I got the results back today, and it was high. It was 107. So I'm confused because I'm confused because I thought I had reversed the prediabetes because I got the A1c down, but then my blood sugar was high, so I'm confused.
Yeah, that can be confusing, but I think that this is something that is probably pretty common. So I think it's great that you brought it up. I'd say, first of all, congratulations on getting your A1c down, losing weight, doing all that, because that's tremendous. And it will really make a difference in the long run just for your overall health. As far as the blood sugar goes on your fasting blood test, you know, blood sugar is something that is never stable, right? It varies all the time. And so when we are measuring the A1c, we're getting an idea of what your average blood sugar is over a period of 2 to 3 months. But what that doesn't give us an idea of is your fluctuations from day to day. And so while some days your fasting blood sugar may be down into the normal range and out of the pre-diabetes or diabetes range, there may be some days where it's going to be a little bit higher. And of course, that's impacted by many different things. Some that are maybe within your control, what you ate the night before, how much you exercise, and some things that are completely out of your control, how well you slept the night before, or whether you're having pain. So I think its take home message would be I would not focus on a single value of a blood sugar ever, um, because it's just a snapshot in time, what that moment. It's more about what you've done for, your average blood sugar and your health in general by getting that A1c down. We know your average blood sugar is lower now than it was when you first had your pre-diabetes diagnosed. And so that's what's really important.
Great. Thank you. Okay, we have a call in from Rosie. Rosie is from Chicago. You're on the line, Rosie.
Hi,
Rosie?
Rosie.
Yeah, I think that might have been me. That's what I was calling about my A1c. I don't know. I need to know medical terms. What do A1c and other terms, what does it mean? I don't know the meaning of any of them.
Sure. So what I heard you ask was about what the A1c actually is. I hope that's correct. Because that is a term that doesn't really mean a whole lot outside of these medical facilities. The A1c is a blood test that is done, can either be done when they draw your blood from a regular blood draw, or with a finger stick test in a doctor's office. And that value comes back as a percentage. So you may hear a number like 6.7%, 7.5%, 8%, which again doesn't mean anything to, to most people that aren't familiar with it. That corresponds with an average blood sugar. So the A1c is just a way for us to get an idea about what your average blood sugar has been over the past 2 to 3 months. And that it's not a perfect test, but it is a test that's been around for a long time, and it is considered reliable and accurate enough that we can diagnose diabetes based on that test. And so if you had an A1c that was 6.5% or higher than that when it was done, then that would have been enough to say that you have a diagnosis of diabetes. I hope that helps.
Great, thank you. And it's just one marker. I mean, fasting blood sugars, 2-hour postprandials, and also if anybody has the luck of having has gotten a continuous glucose monitor that shows all the trends and patterns, that's another way to see how you're doing. Okay, we have a question coming in from Gary. Gary is from St. Louis, Missouri.
Thanks for taking my call, caller, and your guests. I think some of my questions were answered, but just to go over what I was care about, I'm visually impaired, and I've been a diabetic for, I guess, the early 90s. I know one of the things I have an issue with now is, I got some weight on me. It's hard for me to get motivated to exercise. Now, what are some of the things I could do to help to lower my A1c? I'm going to see the doctor next week. I just had some lab work done on Friday, but my question: what are some of the things that I can do can help to lower my A1c, also to get in better health to control my diabetes better?
That's a great question as well. You mentioned not being able or not being very super motivated to do a lot of exercise, and I think you're not alone in that. But exercise is certainly one thing that can help to lower the A1c. And when we say exercise, I think sometimes people envision, working out at the gym or running a marathon. And that is, while those are wonderful forms of exercise, most of us aren't able to necessarily do that. But exercise can just be, increasing your steps in a day, walking more. And that in itself can make a big difference. If you're not able to do exercise, which some people are not, then certainly taking a look at your diet and seeing where there may be areas that you can make small changes to lower how many carbohydrates you're eating throughout a day can certainly make a difference as well. And then third, medication is a lot of times one of our biggest tools that we have to help lower the A1c. And, ideally in my mind, it's a combination of all of these things that we do. We are trying to optimize our diet, make sure that we're being as physically active as we can be for our particular situation. And then also making sure that the medication that we're taking is helping us as best that it can to get that A1c down. I think it's rare that we can achieve our goals by just doing, one of those things and not trying to incorporate the others into our whole, picture of health.
Great. The other thing about exercise or physical activity is, I think if you're struggling with getting it in for whatever reason, I would suggest talking to a physical therapist if you have some, like a knee injury or a back injury, or an exercise physiologist if you're really concerned about heart health. So seeing another specialist, having your doctor refer you, is also a great way to engage in an exercise program. So we have a very interesting writing question. It's from Sanskar Jain, who is from India. And he's a medical student, and he wanted to know, when a patient visits the physician, what are some symptoms that would help reach the diagnosis of diabetes other than just excess hunger, thirst, and urination? So maybe you can give him a couple tips for seeing whether someone has diabetes or not when they come to the office in India?
Sure. That's a great question. I think when we see those hallmark symptoms, it really helps us think about checking for diabetes, but certainly not everybody has those symptoms or all of them. A significant change in weight, a sudden weight loss that is, maybe unintentional, or even if someone's trying to lose weight, they have maybe more weight loss in a short period of time than they were anticipating. That can certainly be a sign of high blood sugars and or undiagnosed or untreated diabetes as well. A lot of people will also report that when their blood sugars are high, or when they haven't yet had the diagnosis of diabetes and they don't know that their blood sugars are high, that they're feeling pretty wiped out all the time. They're just pretty exhausted, and despite trying to do the things like get enough sleep and others that would normally give them an expected amount of energy. So those are the first two that really come to mind to think about, aside from the excessive thirst and urination.
Great, thanks. We have a question coming in from Jane, and Jane is from Georgia.
Hello?
Hi, Jane.
Hi, Jane.
Oh, hope you're having a good day. My question is, I have also an autoimmune problem, and every now and then I have to go on prednisone, and I notice then when I have my A1Cs, which are generally in the 5.4 or 5.7 range, shoots up to 9. Why does that happen?
Jane, that's a great question, and it's something that a lot of people struggle with. So when you are put on prednisone or any other kind of systemic steroid, or a steroid that you take, by mouth, or that you need to get in an injection, it causes our body to become more insulin resistant, and that means that we have a harder time keeping the blood sugars down, because the medications that we're taking, or the lifestyle modifications that we're doing, like following a reasonable diet, and that they're just not as effective when we're in this really insulin resistant state. And if you have to be on prednisone for a period of time, like a week or 2 weeks or even longer, that makes your average blood sugar go up enough that when you get your A1c checked the next time, it's going to be higher. It's going to reflect that. Even if it's been a month or so since you may have been on the prednisone, it's still reflecting those higher blood sugars that you were experiencing when you were on the prednisone.
Great, thanks. Here's another write-in question. Why is it important to discuss kidney health with the provider? Are there tests that should be included with the annual laboratory blood draw?
Yes, absolutely. I mean, we're talking about how diabetes and heart health are connected. Well, diabetes and kidney health are exactly, connected directly as well. And part of what your provider who's checking your annual labs should be checking, and typically are a kidney function test within your blood test, but then it's also recommended to do a urine protein test that is just a random urine sample that you can leave at the office while you're there, to see how much protein is in that urine, and that reflects somewhat your kidney health and how much strain your kidneys may be showing as a result of diabetes. So those are the two main tests that we do, and that your provider is likely doing, once a year or maybe more often, to keep an eye on those kidneys.
And as a sequel to that question, I think a really important issue is if they get tested. I mean, what's the important? You just get tested and find out I have kidney disease. But talk to us a little bit about prevention.
Absolutely. So, if you found out that you have a little more protein in your urine than is expected, that is sometimes the earliest sign that there may be some kidney problems starting or down the road. And that's why we do this test, because it's an opportunity to head off more severe kidney problems. And we have a lot of ways that we do that. One of the mainstays for keeping your kidneys healthy is to manage your blood sugars, and we're already doing that when we are, checking your A1c and making sure that we're meeting goals for that. Another one is controlling your blood pressure, and so one of the things that your provider is going to be checking on, in addition to your blood sugars, are your blood pressures, and if they're running high, they know that that puts you at risk for having kidney problems down the road, and they can start medication or suggest lifestyle modifications to help get that blood pressure down as well.
Great, thanks. So this question comes in from Ike, and Ike is from New York.
Hi, I've been taking Metformin, 2,000 milligrams a day. I take Acto, 45 milligrams a day. How long, what are the side effects of taking that long period of time?
I'm sorry, I couldn't quite. You've taken that for a long period of time, but I missed the question.
So I think the question is, are there any consequences of taking Actos and Metformin for extended periods of time, and how long should he be on them?
That's a good question. I think, both Metformin and Actos have been around for a really long time. And so for a lot of people who have type 2 diabetes, those, that may have been the very first medication that they were started on and have taken it for years and years. Certainly for Metformin, but Actos as well has been around for a long time and is available in an affordable generic form. So a lot of people are taking it as well. I think we don't fully know consequences of taking medications for a certain period of time, 10, 20 years, but the longer these medications are around, there are some associations that we know that that can be associated with them. One thing that your provider might want to check with someone who's taking metformin for a very long time would be your vitamin B12 levels. There's some indication that there's maybe an association with lower B12 levels for people who take metformin who don't. We also know that metformin has to go through your kidneys to get metabolized and excreted from your body, and so they're going to keep an eye on your kidneys. That's part of what we already do in someone who has diabetes, whether they're taking metformin or not. So they're already doing that for you. Actos, in contrast, has to go through your liver to get excreted. So they're going to be keeping an eye on your liver function tests to make sure that it's still safe for you to be on these medications long term there. The one thing with Actos that has come out is that if you have a history of heart failure, and your heart failure is not in a stable kind of form then, or at a stable place, then it may not be safe to stay on a medication like Actos, and your cardiologist might recommend that you be on a different medication or that you stop that medication. But those are some very kind of specific situations that don't apply to a lot of people. A lot of people take both metformin and Actos for a long time, and they continue to be effective, and they continue to be safe because you're keeping an eye on those things like your kidney tests and your liver tests, like I mentioned. I hope that helps.
Thank you. All right, so Valerie. Valerie is from Novato, California.
Hi. My endocrinologist that I've had for about 20 years left private practice this year, and I have an appointment scheduled for one of the new endocrinologists that are now in her former office, and there'll also be lab work. Do you have any suggestions about establishing this new relationship because I haven't broken in and new endocrinologist for 20 years. And also, when you mentioned liver function, could you mention the tests that, if they're monitoring liver function, which tests do that?
Sure. I'll start with the liver function test because I brought that up earlier. When your provider does what's called a complete metabolic panel, or you might hear it as a CMP, part of what's on that panel are several different liver function tests. You may see them abbreviated as an AST or an ALT. These stand for different transaminases that we check their liver enzymes. So there's actually three of them. There's alkaline phosphatase, or the ALT and the AST. So you're going to see those letters maybe on one of those metabolic panels that are checked. As far as breaking in a new provider, gosh, that can be hard, especially if you've been with somebody that has been, a good, had a good partnership with them for a long time, and it can be daunting to start a relationship with somebody new. Well, I mean, if they're taking over your old provider's practice, I'm like hoping that you're going into this visit and they already may know a little bit about your history, and so have an idea about your diabetes history and things that have worked for you and things that haven't worked for you. But if they don't, if this is somebody that you're meeting for the first time and it's on you to give them all this information, I think that would be what I would make sure that I would want to convey is kind of tell your diabetes story, starting from when you were diagnosed and what's worked for you, what hasn't worked for you, and then coming up with shared goals is going to be a big part of seeing if that partnership is going to work for you. We have a lot of the guidelines have gone to having these individualized goals for things like A1c and that. And so making sure that you are on the same page with that new provider as to what your goals are. If they, in their mind, if they, want your A1c to be, at a level that you don't think that's going to be ideal for you, then that would be getting off to, I think, a rocky start. So, I'm sure there's lots of other things but that's the first thing that comes to mind for just starting off in a new relationship with someone.
Thank you. So we have another write-in question, and I think it's a great one. What if your primary care provider does not have any special expertise in diabetes? How do you avoid having to go to so many different people to try and get answers?
Oh, that is a good question. I think that's a struggle that a lot of people probably find. Primary care providers come from so many different, areas and training and that, and some of them really feel comfortable managing diabetes. And in fact, some of them consider themselves to be, that's kind of their passion and their specialty. And if you are lucky enough to have one of those, then you're in great hands. But a lot of primary care providers, just don't feel that they have the expertise that is necessary to give you the best, care that you should have for your diabetes. And in that case, they, are likely to refer you to a specialist. And it's hard when you're managing a whole lot of specialists, but I'd say your primary care provider, if they felt comfortable managing your diabetes, I think they would be happy to do so. But there's a lot of situations where you may have a complicated picture, or you're on a lot of different medications or multiple daily injections of insulin in combination with other medications, and they just feel like it's gotten out of their wheelhouse. And so I guess I would say if they feel like you deserve to see a specialist, I would think about it in that way, is that while it's time consuming and we all have limited time and it's hard to navigate just medicine right now and try to get in with specialists and find a good one, that if your primary care provider feels like that's what you need, then that's probably what you deserve, is to have somebody who this is really their focus and their expertise.
Thank you. As a reminder, for those of you on the phone, press *3, that's *3 on your keypad, and an operator will collect your questions and place you in the queue so that you can have the opportunity to ask your questions. To participate online, type in your name and question in the fields below the streaming player. Press the Submit Question button, and your question will come directly to us. Remember, today's topic is partnering with your clinician, so try and focus on that topic. Okay, so let's go to some more questions that we have here. I think this is a good one. This comes from Gwendolyn, and Gwendolyn is from Pear Lane, Texas. Gwendolyn, you're on the phone.
Hi, Gwendolyn.
Gwendolyn.
Hi. So I'm from Pearland, Texas, and my question was for new diabetes educators. What is a good way to partner with primary practitioners? They usually just,
Did you catch that? It's
No.
what is a good way to reach out to different primary care doctors?
To reach out to them.
So how do you establish
I
a
think,
relationship? Yeah.
well, like find a new one and find a one that's a good fit. I think that it's getting a referral from someone who's had a good experience with a primary care provider might be a good place to start. You can certainly look up a lot of information on providers before you see them, doing a little research into what their training is, what their area of expertise is, or what they're interested in. I think can be a good way to pick a primary care provider too, and make sure that it's something that aligns with with your issues or your values as well. So it's once you have a primary care provider, I think hopefully there's a lot of different ways that you can reach out to them to communicate with them. I know in our office, we use a combination of calling in and getting through to somebody via a nurse or a diabetes educator, but we also have an online portal which allows people to reach out to the providers or the diabetes educators directly and get some help too. So hopefully you find an office that has good communication and that has different ways for you to reach out so that you feel like they are available for you.
Thank you. So we have a question coming in from Samantha. Samantha's from Rock Hill, North Carolina.
Hi, Samantha.
Samantha? Maybe she's gotten away from her phone. Her question is the keto diet healthy for people with diabetes?
Oh, I was hoping that one would come up. That's a great question. So I think there are, different versions of what people consider keto diets or low carbohydrate diets. And some of them can be, very, I think, safe and effective for people who have diabetes. That being said, there's also a lot of different kinds of diabetes and a lot of different combinations of medication that we may be taking for diabetes. And so certain medications may not be really compatible with doing a really low carb diet or eating no carbohydrates for a period of time, while as other regimens are going to be. And so I think you can't really say that it's safe for everybody with diabetes, but there are a lot of situations in which it can fit into your just kind of health plan and your medications. But I would definitely ask your specific provider, whether they recommend it for you, so that they can look at your, your kind of diabetes and the medications that you're on and make sure that it's something safe.
Yeah, and I think having an appointment with a dietitian too is very helpful. And kind of one of the other questions that came in is what is a diabetes diet? And there really isn't one. So there's no specific one, but there are approaches to healthy eating that may help you. But as Joanna said, it kind of depends on your own situation, where your blood sugar is, what medication you're on, et cetera. So having a visit with a dietitian is also very helpful.
Yeah, that's a great idea.
Yeah. So let's look here. We've got a lot of questions coming in. Here's a good one. This one they're all good ones, actually. This one comes from Norman from Scranton, Pennsylvania. Norman, you're on the line.
Yes. My GP wants to put me on metformin because I have a A1c of 6.5. Now, I brought it down a couple of years ago from 6.9 to 6.1 with diet. I just knocked off all the sugars. Well, I'm still off all the sugars, but I now am going to try to do it by knocking down the carbs. But my question about metformin is, I'm hearing that, once you get on it, you can't get off it. Now, am I wrong in feeling this way? Because I don't want to be on it forever. If I have to get on it for a little bit, yeah, but I'd like to know that I can get off it too.
That's a great topic that you bring up. I think a lot of people feel that way about medication in general, or about insulin in general. And I would say I'd answer that in a couple different ways. One is that you can certainly get off medication if we get to a point where we're over treating your diabetes, and that's one of the things that you talk about with your provider when you see them. If you have goals for your blood sugars and goals for your A1c, and if you are able to make lifestyle changes such that your A1c gets down to a point where it's maybe lower than it needs to be, or your blood sugars are tighter controlled than they need to be, then they may recommend that you decrease the dose of your metformin or even stop it. That is certainly something that can and does happen when people catch their diabetes or are diagnosed with it, at an early stage. The other side of that coin, though, I would say, is that one thing that you are experiencing possibly with your diabetes is that it does tend to progress over time. And so when you were able to cut out the sugar, and get your A1c down in the past, that was a huge success. And what you're noticing now is that, maybe that the effects of that didn't last, and that several years down the road, now your A1c is creeping up again. And that is unfortunately part of one of the things about diabetes that we don't have a great way to, address or attack, is the progression of diabetes. And so your provider may be recommending metformin because they feel that there's been some progression, and then that's the best choice for you now. But, ultimately, there's not a medication that we start for type 2 diabetes that we can't stop if your blood sugars and your A1c get to a point where it's no longer needed.
Great. So, listeners, are you familiar with the Diabetes Self-Management Education Program? And some of you might find this helpful. Diabetes education programs provide services that focus on your concerns about diabetes and will empower you with the knowledge and skills to manage it. They link you to support resources in your community. You can find an ADA-approved program in your area by clicking on the Find a Program link on our webpage, diabetes.org/experts. You can also call 1-800-342-2383 to ask a member of our call center with assistance in finding a program near you. And I'm also add that many of the hospital systems have a diabetes education program. You might want to check on them as well. Okay, let's go back to some other questions. And Michelle writes in and says, which is really our topic for today, what type of questions should a diabetes patient bring to their doctor visit?
Well, all of them, I think that you have. But I think questions that are helpful to bring to the visit are, you know, I mean, it can be medication questions. If you have questions about your medication, how they work, when you should be taking them, those are great questions. I would certainly, come to a visit with questions about, am I doing everything that I can to manage my diabetes? As far as, are there any changes that you would recommend for me to make in my activity level, my diet, my this, um, and as we just talked about, asking if there's any other support that would be good, that would help you in your goals to manage your diabetes. And that may be seeing a diabetes educator or enrolling in a diabetes education program, checking in with a dietitian, and making sure that there aren't areas in your diet that maybe you could make that would be helpful. And also, I would ask, am I up to date on all of the things that we keep an eye on in somebody who has diabetes? Am I up to date on my eye exams? Am I up to date on my blood and urine tests that we do? And, should I see a specialist for my feet? Just make sure that they're looking at, all of the things that we keep a close eye on when it comes to your diabetes. Heart health is a huge part of that too. Is there a reason to do any kind of further testing to look at your heart health?
Great, thank you. We have a question coming in from Shirley. Shirley is from St. Louis, Missouri. Shirley, you are on the line.
Yes, my question is basically regarding eating less carbs and how to interface the correct carbs to keep your blood sugar within range. I'm just kind of struggling with when I do eat carbs, it kind of takes it out of range. And I wanted to know, maybe eating too late may be a factor, but I just wanted to know what other pointers I can get to, help keep my blood sugar in range, and keeping in mind that I'm trying to balance with the correct diet for that was recommended in the class.
Sure. I think that's a great question. And we talk about carbs a lot, and, but what does that really mean? And, what are different carbs and how do they work? I'd say ultimately what you'll find is that anything that is a carbohydrate is going to have some impact on your blood sugar. But that doesn't mean that all carbs are, treated equally, or that they have the same impact on your blood sugar. For example, if you have a meal and you have a piece of fruit in that meal, and you choose to have an apple, that those carbohydrates in the apple may affect your blood sugar differently than if you chose to have a glass of juice, or a soda or something like that. So choosing healthy foods that have carbohydrates versus sort of empty calories, or foods that don't provide any health benefits but are full of carbohydrates, is one change that is going to be absolutely worth your while. So if you look at what you're eating and you find that you're having some things that have empty carbs, or carbs that are not really providing a lot of benefit to you, then cut those out. Instead, choose carbs that are going to also provide some nutrients to your body. Choose whole pieces of fruit. Choose whole grain breads and whole grain pastas and things like that, versus things that are processed, or are full of a lot of sugar, and not naturally occurring sugars. But the other thing that I would say is that some people will get into trouble because they might have too many carbs in one sitting. And so one thing that can help your blood sugar from spiking after you eat is to spread those carbohydrates out throughout the day, so that you're not consuming them all, or a majority of them, in one sitting, in one meal. And that can work well for a lot of people, depending on what medication you're on, to spread those out throughout the day there. As far as eating late or, time of day, I hear a lot of people express concern about that. Should they stop eating at a certain time? And I think that's a very individual, kind of response. Some people, if they eat too late, will notice that their blood sugar stays high and that they wake up the next morning with a higher fasting blood sugar. And in that case, I think there's a good reason to consider, not eating quite so late. But that may not be everybody's experience, and they can have a snack at bedtime and not have that same impact.
Thank you. We have a question coming in from Anne, and Anne is from Washington.
Oh, hi. Thank you so much for taking my call. I'm really concerned because when I listen in on these conversations, I sometimes hear the experts talk about complications, and if you bring your A1c down to 7 or sometimes below 7. And my doctor, I used to be 7.1, and for the past year and a half, 2 years, I've been 7.8, 7.9. And recently my family practice doctor said, we're not concerned because you're below 8. You're fine if you're below 8. And I just, but she said, but we'll double your metformin and see how it goes. And I'm really concerned because I don't feel that's in line with your objectives for A1c, and I would like your comments on this, your opinion.
Sure. I think that's a great, question. I think that it's a question that is, makes a lot of sense. And you're right. We do talk about kind of getting that A1c below 7 and keeping it there as a means to prevent or minimize complications or progressive complications with diabetes. That being said, I think we also, sometimes have our A1c goals, and blood sugar goals can change with people's situation. For example, as people get older, we ease up on A1c goals. And so if you are maybe over the age of 70, an A1c under 8% may be, meeting that goal. And if you're older than that, or you have other complications or other significant health issues, your provider may be even targeting an A1c that's higher than that. So there's this whole idea of really an individualized A1c goal. And you're right in that most of the time, that goal is below 7. If we can achieve that without causing too many low blood sugars, too much hypoglycemia. And so one thing that your provider may be looking at is balancing that, balancing your A1c goal with having too tight of blood sugars or having low blood sugars with that. So, but as far as worrying about complications, if your A1c is at or very near goal, then I would say you're still doing a really good job of trying to optimize your situation so that you don't develop complications. And it's very different having an A1c that may be running in the mid to high 7s versus somebody who's letting their A1c stay in the double digits, 12, 14%. So but I would maybe clarify with your provider why their A1c goal is for you maybe less than 8, and hopefully they can explain that to you where you feel more comfortable with it.
Thanks. I think there's also, when we look at goals for glucose, there is A1c, And the national recommendation is less than 7%, but not, as Joanna mentioned, depending upon you and your other conditions you may have and your age and those kinds of things. But there are numbers to look at too, like how much of the time are you running between 70 and 180? So that an A1c is merely an average. So another thing to look at is how much of the time are you running between 70 and 180, which is the standards of goal about 70% of the time. And if the reason your A1c is 6 is because you're running at 30 and 250 most of the time, that average would still be an A1c of less than 7, but it wouldn't be. So the other piece to this is, where are the rest of your blood sugars running? So those are good things to talk to your when we look at what questions should I ask my provider. Those are good questions. Is what are my targets? And besides an A1c, where should I be? And talk to your diabetes team about that. Okay, other questions. There is a nurse that's written in and says, as a nurse, how can I help guide my patients, or what tips can I give them so they can be prepared to talk to their diabetes provider or healthcare provider, PA, NP, MD?
Great question. I think one thing that you can do if you have the ability is to remind people, to come to the visit with their, with their meters, if we're looking at their numbers on a meter, or with their reader, if we're looking at their numbers on if they're using a continuous glucose monitor that requires a reader. So come with your numbers. It is really hard as a provider to see somebody and only have, maybe an A1c or a blood test that was done a while ago, and to know what, what adjustments may or may not need to be made. So encouraging people to come with as much information as possible. And blood sugars is one thing, as I mentioned, but even more information than that. Some people like to keep detailed logs of what their diet has been over the past maybe 5 to 7 days before they're seeing their provider, or when they're exercising, and all of that information can be so helpful in figuring out if your regimen is really optimized.
Great, thank you. We have a question coming in, written in by Barbara, and she would like you to repeat the kidney test that should be done.
Sure. So there's a kidney test that is done with a blood test that is part of a metabolic panel, and that can be either in a basic metabolic panel, or a BMP, or a complete metabolic panel that you might see as a CMP. But the test that you're actually looking for on that panel is going to be a creatinine, and that is a measure of your how well your kidneys are functioning. The urine test that we do is a different test, and that is, we're looking for a specific protein in the urine, and you'll see that as albumin, or urine albumin, and that is going to come across as a ratio or a number on your urine test.
Thank you. We do have a question coming in from Maja from Texas, and this is looking at questions that you ask if you have a child. So here she is.
Hello, I want to thank you guys for. Sorry. Yes, ma'am. I just want to thank you for your time, and I was wondering, are there, how do you know when it's time to take a child to go and talk about diabetes, or just to get checked up for diabetes? And I also want to know, does metformin cause any kind of kidney damage?
Good questions. The first one is about metformin, because I think there's a common some common myths about metformin. And no, it does not cause kidney damage. The reason that people sometimes have to stop metformin is because they may have underlying kidney disease, and it has gotten to a point where it's no longer safe for them to take metformin, not because it's going to cause damage to the kidney or further damage to the kidney, but because it has to go through your kidneys to get excreted, and to get for your body to get rid of it. If you have kidney disease that has gotten to the point where your kidneys can't do that well, then metformin is not, may not be a safe medication to continue. But there is no evidence that it directly damages your kidneys. As far as knowing when is the right time or what's a good time to consider getting screened for diabetes when you have a child, I think it depends on a lot of factors. And so we know there's a strong genetic link to diabetes. And so if you are someone that has a very strong family history of diabetes, whether it's type 1 or type 2, that would enter into when would be, when you might start screening somebody for diabetes. Even kids can get diagnosed with type 2 diabetes. And so if you have a strong family history of type 2, and if your child has risk factors that go beyond that, that family history or those genetics, like if they are, if they're overweight or if they're especially sedentary, then, your provider might want to start screening for diabetes younger than they would in somebody that doesn't have those same risk factors. But another thing is if you are seeing changes in your child that you're, wondering if they could be related to diabetes, such as, a sudden change in their weight, a lot of, weight loss that doesn't make sense, or a change in their behavior, a change in their mood, or that you find that they're, extremely thirsty or going to the bathroom all the time. Just like in adults, those are warning signs in children that it may be a good idea to screen for diabetes.
Great, thanks. Well, I hate to say it, but this wraps up our last question for the session. A few items before we close today. Joanna, could you give us 3 key takeaway points that you want everybody to remember from today?
Well, I think since the topic is partnering, right, with a provider, I think that one takeaway is that this is, that you are not, that you're not in your, your fight with diabetes or living with diabetes alone, and that it should be a partnership with your healthcare provider as well as with, other healthcare providers that might be helping you, such as diabetes educators or registered dietitians or specialists. And so if you feel like if you're in this alone, that, you need to reach out and really make sure that you have a good partnership with your providers. So that's what they're there for. I just think that taking away, a good takeaway message would be, people have a lot of questions about, are they doing enough to manage their diabetes? And do they need to be worried about certain medications or worried about tests that they may or may not have had? And, I think those are really important and great questions to bring to the table to every visit that you have with, with a provider or with a diabetes educator, is to make sure that you're doing everything you can to manage your diabetes. And, asking what's new. I love it when people come into clinic and they say, are there any new medications? Are there any new devices? Are there, is there new technology? Are there new guidelines? And really, want to be, want to learn what's out there and what's new. And that's a great thing to, to bring to the table and to your visits as well. So many other things we could talk about, but those are the ones I think of first.
Thank you. To help you feel confident about your ability to manage your diabetes and heart health, we encourage you and your loved ones to talk to your doctor, provider, and dietitian about your risk for heart disease, stroke, and kidney disease. Go to knowdiabetesbyheart.org and learn more. Register for the next event at diabetes.org/experts and sign up for a diabetes education near you. You can also sign up for ADA's free Living with Type 2 Diabetes program. Links to these resources can be found on our registration webpage, diabetes.org/experts. Thank you for all the great questions you called in and wrote in with. We are sorry we are unable to get to all your questions, and there's a long list of them still remaining. If you have questions about this event, you are welcome to contact us at askada@diabetes.org or by calling 1-800-342-2383. Thriving with Diabetes takes a village, and we're here to support you. Special thanks to our expert, Joanna. I am Carla Cox, and on behalf of the AD team, we want to thank you for joining us today, and we look forward to you connecting with you on our next Ask the Experts events, July 12, Diabetes and Cardiovascular Disease, and August 9, Transitions of Care. We do invite you to take part in our survey, which will help us plan for future events. You may do so by participating in the survey with on your web at https://tinyurl.com/ATE004 via your computer, or texting the code at ATE0614 to the number 833-373-0403. And you can complete the survey on your mobile phone. If you are joining us on Facebook, YouTube, or listening to our podcast, please be sure to give us your feedback by completing the survey. If you have any questions about the event, please email askada@diabetes.org. Include Ask the Experts Q&A in your subject line. And thank you so much for joining us today. And once again, thank you to our expert, Joanna. Hope to see you on our next session.